Great. All right. We are recording. Okay, so welcome everyone. My name is Reggie. I am the resource manager here at Brain Northwest. And today we have the privilege of having Gabby Soeldner here with us. She has been our Brain Northwest intern this quarter, and we are privileged to have the opportunity to be part of her capstone project. Gabby has 15 plus years of working with preschool aged children, and she took the opportunity to lean into that personal experience and do some research and gather some information and blend that with her personal experience as a teacher to bring us this really important information about traumatic brain injury in children. So we're really fortunate. She's me graduating with her Bachelor's of Applied Science from Bellevue College in Health and Wellness Promotion. So this is such a fitting capstone, and it's been a pleasure to work with Gabby on this and as she's developed it and reflected on it. So thank you, Gabby, for being here. I'm so happy to be part of this journey with you and that you got to that you're here providing some beautiful resource and content for our community. So I will mute myself and keep an eye on the chat and go for it.
Thank you. Thank you so much. So again, my name is Gabrielle or Gabby, and I'm doing TBI with children and in correlation with the roles of sleep. A little bit about me. This is my rescue dog. She's about 6 years old. I also have a rescue cat and a rescue chicken. I'm a dedicated pre-K teacher. I absolutely love it. And I have 15 years, like she was saying, of experience with children. In 2 weeks, I'm going to be graduating. So this is my final presentation of stuff that I've just been really interested in and very passionate about. So a little about me. So TBI is basically the disruption of brain function due to an external force. It could be many different things: falls, sports injuries, car accidents, and abuse. And the severity of them ranges from mild to severe. Majority of children fall under the falls and abuse category for TBI injury that research has shown. Children are very vulnerable in many aspects, but especially their brain is still developing. Their bodies are really, really fragile, especially like their neck and their brain. They're very fragile. They have thinner skulls and weaker neck muscles. And with the TBI, this can really affect their behavioral, their academia, uh, and cognitive delays might appear later in life just because for a 5-year-old, if they have a TBI, it's going to show up later in their academic and schoolwork years. Some of the signs and symptoms, they might show physical headaches, nausea, and fatigue. If you ask a 2-year-old or a 4-year-old if they have a headache, they may not understand what that even means. I mean, they might say like, "Oh, my head hurts," but you really see it with the nausea, with possibly throwing up, and then a lot of it is with fatigue because they're having poor sleep and they're just feeling tired from the TBI. They could be confused, they can have memory issues, and it also is going to affect their behavioral and emotional regulations. They're going to be a little bit more irritable and have more severe mood swings and more mood swings. Sleep related symptoms are unfortunately underreported, and it really needs to be a central part of their recovery and not secondary. Um, TBI can also cause issues such as speaking, understanding, and movement. So, something to look for is if they're able to say certain words and then unable to say certain words, they're not understanding, like, oh, please go brush your teeth, or simple age appropriate things, and their movement might be off. They might be able to run, jump, and skip, and then they're suddenly, unable to do that or to do it as they were doing it prior. This can impact public health, long-term disabilities, educational and behavioral challenges that often show up a little bit later in life. And a huge thing is the socioeconomic disparities, and it affects different people, especially the underserved populations. And also, since their socioeconomic, they're going under these disparities, living in the disparities, they get less care, and that is a huge burden on parents emotionally, not just that, but financially. So a little bit more about sleep. TBI can disrupt the sleep-wake cycles, and that it causes insomnia and sleep apnea. So those are two things to look for. And poor sleep, as you know, we all experience, it impacts your daily life. They are going to have worse cognitive and emotional recovery with the TBI and just regulating their bodies daily. Some more about this is slower healing of the brain if you're not getting adequate sleep. So this the very much of the worsening of cognitive and mood symptoms. They're going to have an increase of secondary risk for injury. So if you're not sleeping, a little bit more tired, a little bit more fatigued, you're more likely to trip and fall as a child. And that second injury is very serious. They might even have um, harder time understanding, like, memory consolidation, because when a child learns a bunch of information and they go to sleep, they take their daytime nap or their evening night nap, that's when their memory goes into their long-term memory, and since they're unable to get the adequate sleep, it's gonna affect their memories. Some interventions are screening for sleep issues and pediatric TBI, and then, of course, the follow up care. And sleep issues should be part of the care. It should be first, not secondary. Like I said before, um, the most important thing is education. So the parents getting the adequate education. And again, that goes into if the family's unable to get to the primary care physician, the disparities in socioeconomic is harder for them. Educational for schools. I know for my kids, like I said, I'm a pre-K teacher. I have 4 and 5 year olds, and I'm with them, at least for the full-time students, I'm with them longer waking hours during the week than their parents, honestly. So I would be able to see things as well because I'm with them during their, they're awake, we're playing or we're doing gym type stuff. And then healthcare providers educating them and having them educate you. Behavioral therapies like CBTI is very, very great. Sleep hygiene, so working on that. And then community resources and more access to care are things that all need to be increased. Something to do to support your child. The first thing you want to do is confirm this diagnosis with your doctor. Don't just think that you know. You want to rule out anything else. And that is the most support you can give to your child is just get the diagnosis and rule out anything else so you know how to help them with their care plan. Have a regular sleep schedule, and I know it's really, really hard during summer and holidays, but no late nights, no sleepovers, just getting that sleep routine in their same bed at the same time, that kind of a thing, and no high risk activities like trampoline or roller coasters or bumper cars until it's cleared by a doctor. We want to prevent those for further injuries. Allow more time even for, they might have taken 10 to 15 minutes to get dressed in the morning before school, and now it takes them 45 minutes. Give them that autonomy and that self-defiance um, for for them. And this might even include less hours at school, that maybe going to school for 6, 7 hours is way too long and they need to be more of a part-time student. Educate and communicate with your trusted adults around your child. Let their teachers know what's going on so they can keep a clear eye on them, and just really working with and trusting that person who's with your child. Remember to ask age appropriate questions to your child. I wouldn't ask a child to count back from 30. Start with, age appropriate questions for your child. Here is, I love this graph. And again, in the end of the slides, I'll have the resources for all of this. We're going to talk about the 4 and 5-year-olds because that's who I teach. Magical thinking. So this is what happens in our dramatic play area. And I actually do this inside of my classroom when students go to like the doctor or the dentist. It's usually around this age where they're starting to get like they're understanding and they're remembering, like they're going to the doctor and getting a shot, or they're getting like their teeth cleaned for the first time. For a child, like for me and you, we're just like, hey, we're gonna go get our teeth cleaned, a 30-minute whatever, or go get a flu shot, and just, it hurts, but you move on. They're still processing it. So dramatic play is a time for them to, I have like fake little shots and a fake little set of teeth with like a real toothbrush in our center, and I got a little fake little sink so they're able to clean. And I'll go in there and they'll give me a shot and clean my teeth, and they like to extract all my teeth. And but they're understanding the world around them, and this is how their minds think. And again, even just basic objects like a hospital gown, if you could take that home so they can have time just to really analyze it and play with it, that's how their minds think at this age. And it's great. It's such a magical part of their lives. And there's so many resources as like books and stories that can mirror what's happening to them and other families. And it's how that you can help them understand what's going on. It can be really traumatic going to the doctor and seeing your mom, nervous and not understanding what the conversations are being said. Um, in my research findings, the most important, like one of the most important thing is supporting your child. There is so much evidence of just really focusing on that. And you can support them by making them feel secure, safe, and loved. And that this really can start by listening to them and having conversations. 4 and 5-year-olds, a lot of people are surprised. They know a lot, they can do a lot on their own. And you can have intellectual conversations with them, and, ask them, what they're feeling, and help them talk through it and explain things. Of course, all age appropriate. Not all children with TBI are the same, just like as you may know with adults. Their diagnoses might be different, their care plans might be different. So just remember that they're an individual person, and the care plan that works for someone else may not work for your child or another child. And behavioral cognitive rehab, it might be a necessary thing. So just removing that stigma around that. And it's okay. And just getting them the help early. Getting it early is the best. Their mood changes, positive or negative, are very normal. And again, just be patient. The more you get upset is the more like things just kind of roller coaster from there. And be flexible. Hey, you may not make that birthday party, or you may not make that appointment on time, or you may have to reschedule the appointment. You might be 5 minutes late to work. Be flexible. Give them time. Poor concentration could be a symptom. When I researched a little bit older kids in the middle school, high school range, um, they were saying that teachers might think that these children just don't care, that they can't sit still, that they're just not wanting to learn. So it's just really working with the teacher and letting them know what's happening. And it's not that they can't, or they're choosing not to concentrate. They just can't concentrate. Their brain just cannot do it. Um, and like I said previously, it's really important to stick to that schedule and keep it very consistent. And using visual aids, for my kiddos, they're learning how to read. So a lot of things are that are obvious for us. It may not be obvious for another person, and they can't read, water station. So I have a picture of a water, or someone for washing your hands. I have the hand washing station, and I have like a kid washing their hands. So using these visual aids to make it a little bit more obvious, lack of a better term for them. There's great education And again, it's a resource in my back of my slides. It's a National Brain Injury Associations, and it was amazing. I got a lot of my information from there, and they have so many resources for all different socioeconomics, all different TBI disorders, use resources, and they can actually help meet the individual needs. 4 recommendations or call to actions is integrate sleep assessment and routine TBI care plans. Um, and then advocate for all different approaches. And then we have a huge need for sleep specific sleep research. Advocate for it. There's not enough research on children who sleep, and we just need more. There's not many resources, and there's a huge need for that. Equity and access to care is something that's needed, but there is hope. Research has shown that children have an 80% recovery rate. Um, so it's just getting the diagnosis, getting it early and helping. And my last 4 things I would have to say over all of the information that I have studied is educate, early diagnosis, support, and action. Don't just sit on it, help, make action and support. All right, and that is the end of my slide. Does anyone have any questions? And then if you want access to, oh, sorry, just real quick, if you want access to the resources, I have the resources right here at the end of my slide.
Thank you, Gabby.
Of course.
Do you want me to keep the recording going or do you want me to stop the recording? And
We
then
can
while we ask questions?
we can keep it going. That might
Okay.
be helpful.
Yeah. Okay. Super. I just want people to know that all of those who signed up will get a copy of Gabby's slides with all those resources, which is helpful. Um, and I wanted to point out, I appreciated that you talked about like how the magical thinking is really a helpful way of observing children and maybe getting clues for what's going on, but also as a way to help children work through things that might be scary or confusing. So that was lovely. And also with older students or older children, like not allowing stereotypes to influence or mask maybe deeper issues or problems. I'm thinking about a lot of teenagers that are active in sports, or just maybe they're into more extreme sports, or, hiking or biking, or all sorts of things that someone could bump their head and it could have a bigger impact. And so to really be, educating, professionals and teachers about what to look for. So I appreciate that. Those are like 2 unique ways to think about different age children. So
Yeah,
thanks, Gabby.
of course, of course.
Chloe or Holly, do you have any questions or any personal insights that you wanted to share?
Um, Not really. I mean, there's two different, my son, long story, but in like first or second grade, he was on the playground with another little girl where they used to go to school. There was an outside area, but there was also an outside area that was covered like a basketball court, but it was a bricked in basketball court and there was a doorway through it. And he was running from one side and another girl was running from the other side, not seeing each other. They bumped and hit into they ran through the door, ran into each other, hit their heads. She ended up being fine, but he ended up falling back and hitting the brick wall. And that ended up, anyway, he ended up going to class and then they sent him to the nurse's office 2 or 3 times because he kept saying he wasn't feeling well. He was dizzy and and everything. The thing that, I mean, I love the school and I loved all the people there, but they actually sent him to gym after this happened, and I was like, you gotta be kidding me. But anyway, I took him as a precautionary thing because I was always raised better safe than sorry. And there was no bump, there was no redness, there was nothing. And I thought, oh, the doctor's going to say he's fine. And Seattle Children's Urgent Clinic actually said, well, yeah, he's got a concussion. And I was like, wow, so you just never know. And then one of the things he did tell me during that time was in the car, when we go on the off ramps and on ramps, that turning method of getting on and off a freeway, he would feel really dizzy. So, and now having a TBI myself from 3.5 years ago, I totally relate to what he was experiencing because I had a full on TBI. So it's just, I guess my takeaway with that is just always make sure, always double check, inform everybody. Oh, and then he proceeded to not, I mean, he's a trooper. He's pretty mild mannered and he's a good sport and he's a trooper. So he couldn't do any soccer or anything that's physical in scouts or baseball for about 4 months. And then at school, he had like a little toy box because he wasn't allowed to be near, he couldn't climb on equipment and he couldn't be near any flying balls. And so we just really had to kind of put him in a bubble, so to speak, for about 4 months until the doctors cleared him. And so our experience, luckily for him, was that he pretty much recovered pretty fully. And then I'll say one more thing. One of his classmates, I can't remember if it was before or after, I feel like it was after, ended up having went to one of those fire truck things, was walking on the top of it that they allowed back in the day for one of those fire truck festivals. Ended up holding a balloon, I guess. But anyway, I don't know, I wasn't there. He fell off of it and luckily it was the fire department, so they were able to take care of him right away, but ended up going to Harborview, ended up having a craniotomy. And it was wild to see the personality change. And we lost touch with him a few years ago. Sweetest, kindest kid ever. And then he wasn't that kid anymore. So I know from myself going through it, when you're not, your body is trying to struggle so hard to keep going, and it's not mental, it's all the physiological parts of it. It's just trying so hard to function and move and do all the stuff, that every little thing is just so makes you irritable because you're just trying to get through each moment when your body's not fully functional. So I, like I said, I lost touch with that family, so I don't know if he ever recovered what's the right personality wise or not, but it was a complete shift from one type of person to another during that time. So I'm hoping that he was able to recover more, and because he was a really sweetheart of a kid. So yeah, so I guess just be really mindful, be really aware, be very protective about those, make sure there's no second injuries, because that's, I guess, where a lot of impact can come into, because you need to fully heal before anything else potentially happens. And yeah, just those things, keep your eyes open. That's my experience so far anyway, or with it anyway.
Yeah, that's really great. Thank you. And I'm so sorry that happened to you and
Yeah.
your son. And
Yeah.
where I work, at least where I work, if anything happens with their head, like they fall, and even if I had a little girl and she told me she fell and I gave her ice, and then I still wrote an incident report, and I'm so happy I did because it didn't look like there was a mark, and then 4 hours later there was like a small red bruise. So you may not know, like you said with your son, like there may not be any marks, or it's where you can't see. I mean, what, 40% of your head's covered by hair, but that's,
Right.
again, it's a great testimony to like protect your head. And if anything happens, just check it out, and you really listened to your child and supported them.
Yeah, absolutely.
Thank you for sharing, Holly.
Yeah,
Yeah.
thank you. I saw in the chat too, any resources for making helmets cooler.
Hmm.
I would say for the younger kids, they love stickers, so decorating it with stickers. Older kids, I'm not sure how 8 and 9-year-olds like it. I don't have any resources, but I did see something that they make a helmet, and it has like a little thing if you like have a bun where it fits there. Well, there's different religions where they wrap their hair so it fits for them. But I'm sure Amazon, or has some cool ideas.
It is interesting, like the value of making it cool or having it be fun. Or I know that I've seen covers for helmets, like I don't know, like fabric covers, and they're which might be on Amazon, but they have like they look like a dinosaur, or they can change they have some tails on them, things like that that might be appealing. That's now I'm all curious. So thank you for your question,
Yeah,
Chloe.
that's awesome. I know my kids right now in my class, they love glitter stickers. So if they could just glitterize it and put a crown or something on it.
Mhm. I love stickers too. I wanted to comment, Holly, just thank you for sharing what you shared. And it reminds me of just the experience of loss that parents and or children or both have, and just how real the impact that is of that emotionally, and just how important it is for parents too, or care providers, to get support, because it's hard to see your child struggle, and it's also difficult, like with the story, Holly, of the other little boy who kind of personality really changed. I mean, that's really impactful for the family too. And I know that that happens with adults as well. And that's definitely, I'm aware of a need in the community that hasn't been met. At least I can't find it, for a support group for parents of children that have experienced a brain injury. But I feel like there's different age groups necessary, because the 4 and 5 year olds, being a parent of a 4 and 5 year old with a brain injury, or maybe it was quite different than being a parent of a teenager or an adult. I have a lot of parents who are, taking care of their adult child that has a brain injury. So I'm trying to figure out a way to stimulate that in the community.
Yeah, there's such a wide range of needs, especially when, you might have like a higher functioning child and just like the mood, I can't even imagine. And in my research it said that, but then hearing your story just makes it that much more real, that yeah, the mood and just being patient. So
Yeah.
yeah. Well, thank
Well,
you.
thank you.
Yeah, thank you everyone for being here and supporting me. And please reach out if you have any comments or questions. And even though my quarter is done in 2 weeks, I do want to continue to research this field. I'm planning on getting my master's in healthcare. So yeah, it's a really important topic to me. And I'm really happy that Brain Northwest welcomed me in, and yeah, to be there to support.
Thank you so much, Gabby. Thank you for your time and your research and your passionate heart. It's really wonderful. We need all the supportive, creative, kind, bright people, like helping the world, helping to equalize what's available, and helping education be spread further out. So, Chloe or Holly, do you have any final questions or any final comment? Okay. All right. Well, thank you. Thank you, Gabby. And thank you all for being here. Have a beautiful day. And I will make sure I send you this recording, Gabby. Okay. Bye.
Thank you.
Thank you, Holly.